Okay, we're going to continue on with altered senses. We're going to focus on hearing, so problems with the ear. So basic screening tests of the ear. An otoscopic exam is one of the most common screening devices that we can use. So it's this little handheld tool here that you can see here. We look and we can actually see into the ear canal, and we should be able to visualize the eardrum. And then there's several different things with the eardrum that we should see, or tympanic membrane is the medical term for it. Cone of light is something that should be seen. You should see this. This is one of the bones in the ear, and then you can see the other bones as well. This should be a nice, pinkish color. Shouldn't be red. And if somebody's had a lot of ear infections, like I've been told, my ears look like they have lightning bolts inside here, and you can't see a clear cone of light, just there's so much scar tissue. Here is a cerumen impaction. That's where there's too much wax in the ear, and they need what's called an ear lavage to clean it out. All right, other ones, the Weber and the Rhine. The Weber test for unilateral deafness. It's a vibrating tuning fork that is held against the midline of the top of the head, as you can see here. And the sound should be heard equally in both ears. So if it's better in one ear than the other, then you know that there's some inequality to the hearing. The Rhine test, this is used, it also uses a tuning fork, and it compares bone conduction with hearing and air conduction. So normally the client should hear vibration as air conduction is better than bone conduction. So they should be able to hear the sound. There's like a wah, 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 wah sound, and they should be able to hear. If they can only detect it through the bone, then we know that there's an issue with hearing. Okay, the first, I went too far. Basic screening tests of the ear. So other ones, the whisper test, that is literally you stand so many feet away and you whisper, and you have to kind of cover your mouth so they can't read lips, and you can do one ear at a time. We do these with DOT physicals. Audiometric, this is a soundproof series of tones. So they listen to this device. This is a popular screening thing they do in schools. You raise one hand if you hear the beep, and the other hand if you hear the beep on the other sound outside, and that kind of thing. This one tests the pressures in the ear. This one I've used quite a few times just to, see if the tympanic membrane is picking up those pressures like it's supposed to be. Hearing loss. There's 3 different types of hearing loss, and I talked about these last semester as well. Conductive is usually due to cerumen buildup, and that's the most common cause. Those canal hairs become thicker with age, and earwax becomes denser and drier. So treatments, there's different drops that you can get that are over the counter that help loosen wax up. You can also use a liquid stool softener in the ear to help soften that wax up. They really don't want anything put in the ear. And so if there is a really bad cerumen impaction, we'll flush the ear with warm water, usually with some peroxide or something in it, to help kind of loosen up that wax. And it can take a few tries. If it starts getting really painful for people, then we may take a break and try it again another day. Otherwise, the best recommendation we can give people is take a shower daily, and for a while just let that warm water run into your ears, and then that warm water melts the wax and then it flows out. Don't do Q-tips. Q-tips kind of keep shoving the wax in further, and it can cause cerumen impaction that way. Perforated tympanic membrane can be a source of conductive hearing or fixation of those ossicles, those bones inside the ear that allow us to pick up sound. Sensorineural, this is inner ear auditory pathways. This could be interrupted due to a tumor, infection, trauma. We're going to talk about Meniere's disease coming up, or effects of an ototoxic medication. Lasix, vancomycin, aminoglycoside, antibiotics can cause that. And then it affects the ability to hear lower frequency sounds. So hearing aids may not help with that type of hearing loss. And then presbycusis, this is hearing loss due to aging as the hair cells in the cochlea degenerate. higher frequencies are lost first. That's why when you're talking to elderly, you should really talk in a deep voice. I talk about Dr. Parker, and he has a very deep voice if anybody's heard him speak. And I tell you what, those elderly clients of his know exactly every word he's saying because they can really pick up on those low tones much easier. So it's, we don't want to yell necessarily at elderly, but try just dropping your voice down a little bit. Distinguishing words can be a problem with this type of hearing loss, and then 95% of cases can be helped with hearing aids. All right, the first condition we're going to talk about here is otitis media. So this is inflammation with infection of the middle ear. So risk factors, upper respiratory infections such as in the sinus, that causes drainage, and that drainage kind of gets trapped in the ear on its way out. And then anything, pooling, substances, drainage in a warm environment is just asking for bacteria to thrive. So that's what happens. You can also have eustachian tube dysfunction. So the eustachian tube, as you can see in this picture here, it's this little tube here that kind of connects to the back of the throat. And that should be open and draining, and it allows for pressure changes and that kind of thing. If that becomes inflamed or clogged, then fluid can't drain properly. Teething in children is also a common cause of otitis media. Assessment, the number one assessment is going to be ear pain. Anybody that's ever had an ear infection or has little ones that have ever had ear infections, they are in pain. My little guy, he's had probably 3 ear infections. He's probably due to get tubes, honestly. But anyway, so ear pain, fever. And then if you do an otic exam, they're going to have redness of the auricle and the ear canal inside. They'll have lymph nodes that are enlarged around the chin area and the neck, and that's possible. And then altered hearing, because that inflammation isn't allowing the tympanic membrane to function as well as it's supposed to be. And if there's a buildup of fluid, you can see that here's a bulging tympanic membrane. It's not the same as over here. You can see it's very red, and especially around the outside. So that's a very infected, very inflamed tympanic membrane. So the best way to diagnose this is with a tympanic membrane exam and otoscope. And we look for it to be retracted or bulging, red, or very, very dull. If it's even paler than this, then we know that there's like an interruption of fluid, or interruption of perfusion. And then landmarks not present. What does that mean? Like the cone of light, you can't see that. You can't, like this, you can't see that cone of light. You can't see the little bones inside here. So we know that that's a problem. And then other times, like they call it with effusion. That's another term for having water or fluid drainage in the ear. You could actually see a line across here that's where the fluid is going up to. And that can really dull people's hearing. All right, so different treatments with otitis media. You're going to see this over and over and over again in healthcare. Antibiotics are going to be treated. So there's a couple of schools of thought here. You're going to hear a lot of docs that don't believe in antibiotics with ear infections because, usually they do start off with some kind of viral illness that has happened. That is true. But more times than not, a bacterial infection is actually going to set in because of that virus, and the immune system already compromised because of that. So, I find that docs have 2 schools of thought with this. They're either going to treat every case of ear infections with antibiotics because they know that there is long-term consequences to it. Like I think about my own ears. When I was a kid, my parents' doctor that they took us to, he didn't believe in antibiotics for little kids. Well, now my hearing is affected because of it as an adult. There's so much scar tissue from having ear infections over and over and over again. So that's why a lot of docs will just treat otitis media. An earwick is for very severe infections where that canal is very, very swollen. It's this little spongy material that's inserted into the canal, and then we actually drop eardrops onto this little earwick, and then that will start to allow the inflammation to go down because of that localized antibiotic treatment. Eventually that earwick will just fall out when it's ready to. Decongestants such as Sudafed or pseudoephedrine are very effective stuff. They're behind the counter at the pharmacy. You have to ask for them, sign for it, show your driver's license, all that kind of stuff. It is a stimulant, so it will raise blood pressure and pulse rates. So if somebody has high blood pressure already, this is a medication they probably shouldn't take, or take with guidance from a doctor. But it is very, very effective. Antihistamines such as Benadryl are also effective, just knowing that, that kind of causes some drowsiness to it. Analgesics for fever such as ibuprofen and acetaminophen. And ibuprofen tends to work better just because there's such an inflammatory component to this that just kind of does the trick a little bit better. Warm compresses over the ear and across the jaw and into the neck a little bit helps ease some of that pain. There's a few cases where an ice pack feels better to some people, but more often than not, it's heat that feels better. And then swallowing warm liquids kind of helps with that eustachian tube. Don't put warm liquids in the ear. There's a lot of old school remedies that call for putting hot olive oil in the ear or hot candle wax or putting a candle next to your ear. We don't recommend those things. That causes infections to become worse. People can burn their ear canals or their tympanic membranes. Don't do those things. Don't hold a candle by their ear. That's a warm compress. That's what that's doing. So we have safer ways of doing that. Surgical fixes. We could do something called a myronotomy, or set somebody up for that, which is a surgical drainage of the middle ear. A ventilation tube may be placed, which is a tympanostomy. This is not as effective for adults that get frequent ear infections, but very effective for little kiddos. So an incision is made into the eardrum. That's what this picture is up here. Fluid is aspirated because they're getting frequent infections because fluid keeps building up behind the eardrum, right? And so in order to let that fluid drain, they do this incision, aspirate any fluid that's there. They put this little tube in that allows fluid and air to escape as it needs to, and then that will actually fall out when the person as they age and grow up. And so things with post-op teaching: avoid straining with bowel movements, do not drink through a straw for 2 to 3 weeks, avoid air travel because of those pressure changes, avoid getting water into the ear canal. And as I said, it will fall out on its own. Sometimes a doctor will remove. My sister had tubes in her ear, and I remember when they fell out, and we just my parents kept them in a jar forever, I guess. All right, Meniere's disease. I want to finish up with this one. So Meniere's disease is a chronic inner ear disorder that is caused by excess fluid and pressure in the labyrinth of the inner ear. Assessment: this is reoccurring attacks of vertigo. Vertigo being the main one, tinnitus, which is a constant ringing in the ears, and then gradual hearing loss. The attacks occur spontaneously and are unpredictable. They can last anywhere from a few minutes to a few hours. For diagnostics, you kind of have to rule out everything else. There's not a particular test for this. So they're going to look at anatomical and other functional problems, and if those all check out, then it's probably Meniere's. One thing that they have to have is definite hearing loss. Treatments are going to be medications to treat the vertigo and the nausea that goes with this. Meclizine, which can be available over the counter. The brand name that you're probably familiar with is Dramamine. We can do prochlorperazine and hydroxyzine for also that nausea and kind of vertigo feeling. Diuretics have been known to help. We want to maintain fluid and electrolyte balance. Bed rest with minimal stimuli, so a darkened room that's quiet. We want to encourage a low sodium diet. And then a surgery may be needed to relieve some of that inner ear pressure. All right, I'm going to stop this recording here, and we'll continue on to a next one.